mole or lesion that is being removed. And again, this is not a procedure that would normally be performed in the primary care setting. It's a fairly simple procedure and worthwhile demonstrating. And this is how most moles that are larger than one that can just be scraped off or cut off are removed. So once this is removed, this wound can now be converted to a nice, neat laceration with the wound margins coming together, and it is now just a straight laceration that can be closed fairly easily with simple interrupted sutures. Tongue lacerations are sutured only if they are gaping, large, and gaping, or if they result in a forked tongue. In general, most tongue lacerations that approximate well are treated purely with symptomatic care. Children like popsicles. It feels good and does no harm. These usually heal well without any treatment other than observation to make sure there is no infection. When treating fingertip avulsion lacerations, if the avulsed segment is less than 1 square centimeter, then treatment can be merely closure with adaptic or xeroform dressing. If you do this, let the patient know that it's going to take weeks for this to heal. If the avulsed area is greater than 1 square centimeter, then plastic surgeons believe this should be closed with a graft, and obviously you would call a plastic surgeon in for that procedure. This is a sterile disposable suture set, and I'm going to demonstrate how to set this up in a sterile manner without assistance. In the primary care setting and frequently in the emergency department, your staff is too busy to assist you, and it's a fairly simple procedure. Once the tray itself is opened, keeping everything sterile, you then put whatever you need on the tray. Your suture material. I like the Zero Wet Splash Shields. At this point, you put on one sterile glove, and this allows you to have one hand to touch anything that is sterile and the other hand to touch that equipment which is not. So that you can use your solutions. I like betadine and the normal saline or irrigation fluid, whatever that may be, and the local anesthetic. This is all easily performed without any other help. You then insert this into the sharps container. You put on your other glove, and now you are all set to do the procedure. Several needle devices have been made to decrease the chance of needle sticks, and this is one type. It looks a little bulky, but it's actually fairly easy to use once you get used to it. Just like any other needle, when it's added onto the syringe, it's used, and then once it's finished, it's capped like this. And there's no way that you can stick yourself with it. It's a completely safe needle at that point.